Okay, so I am now recording. I unfortunately was not prepared for this, so I don't have my textbook with me, but I'm going to run through the PowerPoint slides. But if you're trying to follow along in the book as well, I'm not going to be calling out page numbers because I don't have that with me. I have the digital version, but with the digital version, I can't see the full PowerPoint slide. So, Chapter 26 is revolving around the gastrointestinal system. Also, if you have not seen already, I've moved the test to tomorrow, and whenever the Zoom meeting concludes, I will get the revised testing schedule posted under the News and Announcements tab on e-learning. For those of you that have access to e-learning, it was also included with the daily question today. All right, so we have Figure 26.1, which is showing you the digestive system, all diagrammed and labeled out. So let's look at the anatomy of our digestive system. And I'm sorry, I don't know why this won't go back up and away. I apologize. Stuck with that bar on my screen and it's messing with me a little bit. So, anatomy and physiology of the digestive system. Your digestive system is basically a long tube that extends from the mouth all the way down to the anus, and there's a series of hollow organs along its length, such as the liver, which produces digestive juices and bile, the gallbladder, which stores bile, and the pancreas that produces digestive juices and enzymes. So we have 6 main parts or organs in the digestive system, starting with the mouth. And then we go down to the esophagus, the pharynx, the stomach, the small intestines, and then the large intestines. We also have accessory organs whenever it comes to the digestive system. There are 6 things like the teeth, which are going to assist the mouth in doing what it does. Same thing with the tongue and our salivary glands. The liver, gallbladder, and pancreas are also considered accessory organs. So our body uses digestion to do a number of things. It breaks down our food. Also break down of food substances into nutrients that can be used in the body processes so that we can have energy or building material, so to speak. It also transfers what it cannot use out of the body as waste or excretion and reabsorbs water into the body's tissues to prevent dehydration. So let's look at some of these features a little more closely, and the first of which we're going to look at is the mouth. This is the opening of what we call the alimentary tract. This is where you find our tongue, our teeth, and saliva. All of these things are going to begin that initial breakdown process. Mastication is the medical term for chewing, and that is what breaks our food into smaller pieces. Our saliva is going to moisten that and add some pre-digestive enzymes such as ptyalin, which breaks down carbohydrates, into monosaccharides, glucose, and fructose. This is so that it can break it down into nutrients that our body can actually utilize. The tongue is going to move bolus. That's what we have. That's the medical term for that partially chewed food. To the uvula, which is the dangly thing at the back of the throat, if you did not know the name of that. And both are going to assist in swallowing. The food will then pass through the pharynx, that's our throat, into the esophagus as the trachea or windpipe is closed off by the epiglottis. So you are not breathing when we actually swallow. We take a brief pause. Next, we have the stomach, which consists of 3 parts, the fundus, the body, and the pylorus. Smooth muscles continue persistalis. That's the movement of things through the digestive system. So it will move that food, and now that it is partially chewed and has been affected by the predigestive enzymes of our saliva, etc., that is now referred to as chyme. And so that chyme gets moved into the digestive tract. The walls of the stomach sense weight or the presence of food, and the peritoneal cells make and secrete hydrochloric acid, which converts pepsinogen into the enzyme pepsin. And pepsin chemically breaks down protein into amino acids. About 4 hours later, that peristalsis moves the chyme out of the stomach through the pyloric sphincter. So now we're starting to get into the small intestine. We have 3 parts to the small intestine. These are the duodenum, the jejunum, and the ileum. So 80% of all food is chemically digested in the duodenum. This is also where 80% of all ulcers occur, because that is where that food is being broken down. It's also where a lot of medications get broken down. Secreted bicarbonate neutralizes stomach acids and raises the pH in the small intestine to slightly acidic, about 5.5 on the pH scale. Lipids and proteins or amino acids are also broken down. So our pancreas will send three enzymes, trypsin, which further breaks down the remaining proteins into the simplest amino acids, amylopsin, which breaks down the remaining carbohydrates and simple sugars into monosaccharides, and stepsin, which breaks down smaller molecules of fat into fatty acids and glycerol. Monosaccharides, amino acids, fatty acids, and glycerol are absorbed into tiny lymph vessels called lacteals and are passed to the liver. So the large intestine is also what we refer to as the colon. This consists of 7 parts. The first is the cecum, and we have the ascending colon, the transverse colon, the descending colon, the sigmoid colon, the rectum, and then the anus. So that large intestine is where waste or material residue that was not absorbed by the body will move through the ileocecal valve that connects that lower ileum of the small intestine to the cecum. Smooth muscles mixes waste and allows water to be reabsorbed. There's a high amplitude propagating contraction or HAPC that helps that process occur. Food waste and bacteria remain in the large intestine for about 30 minutes. So let's look at some of the disorders of the digestive system. The first disorder we're going to look at is GERD, or gastroesophageal reflux disease. This is also commonly called heartburn or even just acid reflux. So this occurs if the lower esophageal sphincter relaxes when it should contract, causing regurgitating of stomach acid back up into the esophagus, which, by the way, does not have the same lining that your stomach has, and therefore it erodes very quickly from this acid being where it does not belong. So treatment includes something like a GI stimulant or a dopamine receptor antagonist. Doctor might even utilize antiemetic or anti-nausea medications to help keep that acid in check and down in the stomach where it belongs. Nausea or vomiting is another issue that we deal with within the digestive system. Nausea is defined as that feeling of awareness that something is stimulating the vomit center and that vomiting is going to occur. I don't know about y'all, I get like a tight sensation in the back of my jaw. My mouth wants to start watering excessively, things like that. Vomiting, or that medical term is emesis, is produced by the involuntary contraction of the abdominal muscles when the fundus and LES are relaxed. This causes that strong ejection of the gastric contents. So ulcers is another very common issue with our digestive tract. And an ulcer is simply a sore on the inside or flesh wall of the stomach or intestines. This is caused by an overproduction and secretion of the peritoneal cells. Peptic ulcers form in the lining of the stomach or the duodenum. And most ulcers are caused by bacterial infections or medications, such as your NSAIDs or your nonsteroidal anti-inflammatory drugs and anticholinergics. Those things are really harsh on the stomach. That's why you'll see a lot of times that they'll have that little auxiliary label providing additional information about the product. It will instruct patients usually to take this with some type of food. Um, These ulcers can also be caused by or exacerbated by smoking, alcohol consumption, and food hypersensitivities. So, ulcer therapy usually is going to be a 10 to 14-day regimen of one or two antibiotics plus ranitidine bismuth citrate or bismuth. That is Zantac or Pepcid. Doctor might even utilize proton pump inhibitors or PPIs, things like Nexium and Prilosec, to again, in an attempt to keep those acids down in the stomach in check so that they don't erode the esophagus. Diarrhea is another common digestive system disorder. Diarrhea is defined by many loose bowel movements. It is caused by an underlying condition or infection. Also, irritating foods can cause this problem, or overuse of laxatives. Certain cancers, diabetes, even an overuse of alcohol can all cause diarrhea. With diarrhea, dehydration can occur, especially in patients who have a long bout or an extended period of diarrhea. That's why it's so important. After a day or two still dealing with the problem, it's time to seek medical attention. Also, a lot of times the doctors, especially in youngsters, are going to prescribe things like Pedialyte. Again, it's in an attempt to prevent that dehydration. We have over-the-counter and prescription treatments for diarrhea, which include loperamide and bismuth, which goes by the brand names of kaopectate or Pepto-Bismol. That loperamide, by the way, is available as prescription and over-the-counter. There's also a prescription item by the name of Lamodal. That one is actually a controlled substance because of things that it can do to the body. There's a limitation on how long it can be utilized. And then there's an injectable called octreotide that may also be utilized in some of those more severe diarrhea cases. And then, of course, the opposite problem is constipation. This is a GI condition that is characterized by hard, dry, small-sized stools that are difficult to pass. Constipation is considered to be fewer than 3 bowel movements per week, and is accompanied by symptoms of straining, bloating. There may be some abdominal pain and even distension because the intestine and colon are starting to swell from that excess backup, or the sensation of incomplete emptying. People feel like they didn't fully go. This is a symptom, though constipation is technically not a disease. Some of the causes for constipation, though, can include a high-fat, low-fiber diet, a lack of physical activity. As we move, that actually helps our intestines with that persistalis um, factor. So if you have somebody that is bedridden or laden, there may have more problems with constipation than somebody that's up moving around. And again, medications would include things, or medications that can cause this problem, I'm sorry, include the loperamide that was utilized in the case of diarrhea. We can go from one extreme to the other. A lot of your opioids can also cause constipation, so things like codeine, morphine, and even iron supplements. Also, an abuse of laxatives. Some of you may have heard of the people trying to use laxatives for weight loss. That is not advisable. And prolonged use of laxatives can actually cause your body to rely on that medication in order to do its job. So in other words, you would kind of sort of get stuck not being able to go unless you use the laxative. And again, that's going to occur with prolonged use. Also, a suppression of defecation, maybe somebody that's holding it too long. And again, you're going to get into that a lot with your elderly. Maybe they're having mobility issues and things like that. So they're trying to wait and spread the, number of trips that they have to make out. So that can cause constipation. Milk is also known to cause constipation. And then certain disease states, as mentioned previously, with the diarrhea, we have disease states that can exacerbate constipation, such as multiple sclerosis, stroke, and even diabetes, which, if you recall, was also listed under diarrhea. So then poor diabetics are just all over the place. Changes in lifestyle can also exacerbate constipation. It occurs more frequently as one ages, and again, that gets into some of the mobility and things. Pregnancy, because sometimes those infants or the baby still in the womb will sit on the bowel and cause obstructions. And traveling, because again, that is usually when most people are going to try to suppress their defecation. Maybe they're traveling, they don't feel comfortable where they're at, things of that nature. So treatments for constipation would include laxatives such as bulk forming laxatives, emollient laxatives. We have evacuants. There are fecal softeners and surfactants to help with the, I guess, hardness, if you will. And I apologize. I know this is not the most lovely of topics. We also have hyperosmotics. Those work by pulling the water into the colon to help that water will then assist with the passing of the stool. Saline and stimulants or irritants. So flatulence, if you did not already know, is the medical term for gas or passing of gas from the stomach and intestines. It is normal to pass gas several times a day, but of course it can be socially embarrassing. And ladies, I read somewhere that we actually do this a little more than the gentlemen. So this is usually treated with over-the-counter remedies. There are some prescriptions that exist, such as the antibiotic rifaximin, which then leads us to irritable bowel syndrome. This is commonly referred to as IBS for short. This is a long-term illness involving the large and small intestines. It can be triggered by certain foods, stress, hormones, GI illnesses such as Crohn's disease and ulcerative colitis. Also, those, it's not mentioned here on the PowerPoint slide, but those lower abdominal surgical procedures can also add to this problem just because of the manipulations and their close proximity to the bowel, the large and small intestines, etc. That can cause irritable bowel syndrome as well. So treatments include SSRIs and tricyclic antidepressants to assist with this irritable bowel syndrome. So that's a little different, right? Maybe not quite where your mind was going. Next, we have Crohn's disease. This is a lifelong inflammatory disease that causes swelling, deep sores, diarrhea, and even belly pain. Drug treatment can include cyclosporine and IV corticosteroids, biologics, and drugs that suppress the immune system, antibiotics, and aminosalicylates. Other recommendations include reducing stress and avoiding foods that aggravate the condition, which is usually oily substances and anything like popcorn, because those kernels, as they digest, can get in there and agitate and add to problems. Next, we have ulcerative colitis. This is in the IBD family, that just irritable bowel disease family is what IBD stands for there. This affects the lining of the large intestine or the colon and the rectum. The cause is unknown, but mostly affects those with a compromised immune system. Medication treatments include the aminosalicylates, corticosteroids, immunomodulations, antibiotics, and biologic therapies. Some of you may have heard of diverticulitis. So within the colon, we have diverticula that form in the walls of the colon's large intestine. These can become inflamed. It's very painful and uncomfortable from what I understand. Symptoms would include abdominal pain and cramping, nausea, there could even be fever, chills, constipation and or loose stools with diarrhea, and in some cases even rectal bleeding. So treatment's going to include antibiotics, pain relievers, and emptying the stomach via a tube, or if it in severe cases might even require surgery, and there will most likely be changes within the individual's diet regardless of the treatment method. So let's talk now about nutrition. So modern daily food intake recommendations based on nutrition and your health. Dietary Guidelines for Americans of 1980. This was put out by the USDA and DHHS. These have revised or are revised every 5 years. And I see we're getting close on time. So if this does cut out, I apologize. I will post the remainder in a second recorded video. So recommended dietary allowances or RDAs have been replaced by dietary reference intake or DRIs. This is an estimated average requirement. The nutrient value is estimated to meet the needs of 50% of the population. RDA value that prevents deficiencies in 98% of the population. So they're trying to ensure adequate intake, and they set that value for nutrients that do not have an RDA. Tolerate UL, the highest value of nutrient that is not likely to pose adverse effects in 98% of the population. So macronutrients include nutrients that the body requires in large quantities, such as carbohydrates, proteins, fats, also known as lipids, and these are measured in kilocalories or kcal for short. Carbohydrates are things, your complex carbohydrates, are things like fruits, vegetables, whole grains, and legumes. Simple carbohydrates are your sugars. Carbohydrates break down into simple glucose during digestion. That is why your diabetics have to be so mindful of their carbohydrate intake. And carbohydrates are actually necessary to maintain muscle glycogen, which is the preferred fuel for exercise. So there's really nothing wrong with consuming carbohydrates. It's when we consume them. You don't really want to necessarily consume your carbohydrates before you go to bed for the night. You need to be able to burn those off. If you're getting ready to go to a workout session at the gym, that's when you want to consume your carbohydrates so that you have the power needed for that exercise. AMDR for carbohydrates is 45 to 65% of the daily caloric intake. And again, it's about watching when you consume those carbohydrates so that you have time to burn them off. Next, we'll talk about the fats, also known as lipids. We do need fats in our diet. These provide lubrication. They also provide an energy reserve and insulate us to provide some warmth. Fat is how we cushion or shock our shock absorb for our vital organs. And fats help metabolize carbohydrates and proteins more efficiently. So you don't want a completely fat-free diet, but you definitely need to watch the consumption, the quantity, and again, watch when these are consumed. The vitamins that carry fat soluble or that are fat soluble are vitamins A, D, E, and K. And the body's only source of linoleic acids, essential for growth and skin maintenance. So again, we need some fats. The recommended daily amount for fats is 20 to 35% of the caloric intake. You don't want more than 10% of those to be from saturated fat. Saturated fats are what causes cholesterol, and those are your bad fats, if you will. And then we have our proteins. This is the body's main building blocks. There are complex strings of amino acids. We have complete or essential proteins that have the needed essential amino acids to build other proteins. And the body requires 20 different amino acids. Those are detailed in a little table in your textbook. And excessive protein intake can actually lead to dehydration. So in moderation. Too little protein, however, can result in an iron deficiency. So it's a nice middle road that you need to find with those proteins. And there's the table I was referring to. And again, I can't get that bar to move for me to be able to see what the table number is. Oops. Those are your non-essential amino acids and your essential amino acids. Now we're going to try to get through the micronutrients, which are the nutrients that the body requires in small quantities. We already mentioned our fat-soluble vitamins, A, D, E, and K. We also have water-soluble vitamins, B and C. And of course, when we talk about vitamins, food sources are always going to be best. But if due to allergies or sensitivities, food source can't be your primary source, of course, there are supplements available these days on the market. So let's look a little closer at some of these vitamins. The first is vitamin A. The source of vitamin A comes from your orange, yellow, or green leafy vegetables. Function of vitamin A is to help with our eyesight. It also helps with epithelial cells and tissues or your skin cells. A toxicity can form in children who take doses greater than 100,000 micrograms and pregnant women who take isotretinoin for skin conditions, which may cause birth defects. Remember, we talked about that isotretinoin in the skin chapter. So I don't know what pregnant woman would be taking that to begin with because it causes birth defects. Vitamin D is sourced through sunlight. We're a little bit like plants that way. We kind of synthesize vitamin D from the sunlight. We can also get it through fortified milk and supplements. So the function of vitamin D is to improve absorption of calcium to make our bones and teeth strong, help maintain that density. Vitamin E is obtained through nuts, sunflower seeds, eggs, butter, and green leafy vegetables. This is a strong antioxidant for lipids, and it also helps with our skin. Vitamin K comes from dark green leafy vegetables. Vitamin K is necessary for blood coagulation. So if somebody has too much Coumadin or warfarin, that anticoagulant, vitamin K is the antidote to reverse that. Vitamin K is also needed for calcium uptake in the bones, and it is an antidote, as I just mentioned, for that Coumadin overdose. Drugs that contribute to vitamin K related hemorrhagic disease, and I'm sorry I said that a little wrong, would include the anticonvulsants, anticoagulants, certain antibiotics, specifically the cephalosporins, salicylates, and megadoses of vitamins A and E. Vitamin B1 sources include fortified bread and cereal, sunflower seeds, peanuts, beef liver, pork, seafood, egg yolk, and beans. B1 causes a deficiency in B1 causes a disease called Burberry, which affects the peripheral neurologic, cerebral, cardiovascular, and GI systems. So as you can see, we need our B1. B2 comes from liver, nuts, cheese, eggs, milk, green leafy vegetables, whole grains, and fortified cereals. It functions for the health of the mucous membranes in the digestive tract and also aids in the absorption of iron and B6. B3 comes from meat, liver, and peanuts. It is important in oxidation reduction reactions, and it is vital in protein metabolism. B5 comes from meat, brewer's yeast, eggs, fresh vegetables, beans, mushrooms, nuts, and whole grains. It is important for the secretion of hormones. It also maintains healthy skin, muscles, and nerves. It is used in the release of energy and metabolism of macronutrients and used in the manufacture of lipids, neurotransmitters, steroid hormones, and hemoglobins. B6 comes from fortified cereals, beans, meats, fruits, and vegetables. It is needed for red blood cell formation. It is used for antibody production and needed in cell respiration and growth. It is also used for conversion of tryptophan to niacin and maintains normal blood glucose levels, as well as maintains the health of lymphoid organs, and it is needed for the synthesis of neurotransmitters. So I'm going to stop my screen share there because we have very, very little time left. Again, I will post this in a separate recording. I'll post the remainder. And also, please notate the alternative names for these various vitamins within the textbook. I'm sorry. So the textbook has like B1 and it has the alternative name. For example, vitamin C is ascorbic acid. So that's what I'm meaning by the alternative names of these different vitamins. Again, be looking for a separate video recording a little bit later today. And I look forward to seeing you all back tomorrow.
Can't wait. Woohoo.